Good morning everyone, my name's Rob McInerney. I'm the Chief Executive Officer for IRAP, the International Road Assessment Program. And we have a very exciting day for you here today because we will be launching our new Vaccines for Roads report and our IRAP Big Data tool. IRAP is a registered charity that's working in over 90 countries around the world with development banks, with mobility clubs, with research partners all around the world to fulfil our vision for a world free of high-risk roads. So today we're going to talk to you about Vaccines for Roads, available at vaccinesforroads.org, where we can show you how safe are the world's roads today. Where are we at? Are we 1 or 2 star for pedestrians, for cyclists, for vehicle occupants, for motorcyclists? Looking at case studies of success, where countries around the world have made systematic and large-scale investment in their road infrastructure to improve the safety for every one of those road users. And importantly, looking at what is possible. If we focus on achieving the UN target for greater than 75% of travel on 3-star or better roads by 2030, how many lives will we save? And importantly, what is that return on investment? So when we look at the tragedy of road trauma around the world, the toll is at a tragic level. It is a road safety crisis. Each and every day on the world's roads, 3,500 people are killed. But that is just the tip of the iceberg. When we look at what happens in terms of the serious injuries that are impacting people each and every day, an estimated 100,000 each and every day, they are injuries like amputations, like quadriplegia, paraplegia, brain injury. These lifelong injuries that place a burden on families, a burden on the individual, and burden on health and insurance systems. We cannot afford not to do something about road safety because between now and 2030, we estimate some 15 million people will be killed on the world's roads. And 500 million will have these types of injuries. The world cannot afford to just wait for that to happen. And the good news is we have the vaccines for roads that will deliver cost-effective treatments around the world to solve the problem. And this has United Nations backing. The United Nations has set the goal to halve road deaths and serious injuries. They have also set the Sustainable Development Goals in place and have launched a UN Road Safety Fund to address this problem on a scale like never before. And importantly, as we know, if you don't measure it, you can't manage it. They have set 2 key targets in relation to road infrastructure, and that is to make sure that we don't build any brand new killer roads, to make sure that by 2030, all roads achieve technical standards for all road users, pedestrians, cyclists, motorcyclists and vehicle occupants, and bringing them up to that 3-star or better rating. And likewise for existing road networks around the world, making sure that we end up with more than 75% of travel on 3-star or better roads by 2030. This is possible. We can make a difference on a scale that matters. And so now what we'd like to do is to launch the IRAP Big Data tool at vaccinesforroads.org. We've been doing assessments with governments, development banks and other partners all around the world in low-income countries, middle-income countries and high-income countries. And we have data from 54 countries, some 700 billion kilometres of travel on those roads and some 400 million data points across 358,000 kilometres of roads. We have big data, and that big data is telling a very powerful story, and I'll now ask Greg Smith to come up and give you a demonstration of just how powerful that data is. Greg.
Thank you, Rob. So what Rob is going to do is take us through to the new website, which is vaccinesforroads.org, and it's open to everyone to take a look at. When he opens up the chart and the tool, you can see that you see 4 different pie charts. One pie chart is for vehicle occupants, one is for pedestrians, another one is for motorcyclists, and another one is for bicyclists. So a standard IRAP assessment produces a star rating for each of those road users. The star ratings range from 1 star through to 5 star. Highest risk is 1 star. 3 stars is okay, and 5 stars are the safest. When we're looking at this full data set right now, where we've got about 360,000 kilometers of data there, you can see across all of that data, more than half of the roads are rated 1 or 2 stars, so in the higher risk categories for vehicle occupants. For pedestrians, a huge proportion is rated 1 or 2 stars. And for motorcyclists, you can see a large proportion of the roads are 1 or 2 star, and similar situation for bicyclists. That in itself tells a really interesting story. It helps to explain why road crashes are one of the biggest causes of death for people worldwide. In fact, road crashes are the biggest cause of death for young people worldwide. And the condition of the roads and the lack of safety facilities is a key factor in that. If we do some of the filters to start to see what some of the stories we might be able to find are, I'll get Rob to take a look at New Zealand, for example. So we'll zoom in on one country. We're picking New Zealand because they have a very interesting story. If you scroll back up, you can see that more than half of their roads are rated 1 or 2 star, and this is a sample of about 6,000 kilometers of roads. So in terms of length, quite a few of their roads are 1 or 2 star in the high risk category. But if we shift the data now through to travel, so now we're looking not just at the length of road, but the taking into account the traffic volumes on those roads, so the number of kilometers that people travel in their cars. And you can see that the 1 and 2 star percentage has reduced significantly. So a large percentage of the network is now rated 3 stars or 4 stars. What that's telling us is that although there's a fairly large number of 1 or 2 star roads, most of the traffic is happening or being carried on the roads that are 3 or 4 stars. So most people are actually using roads that have got a better star rating. So that's an indication to us that the New Zealand government has really invested quite well in their network in terms of safety. They've focused on the roads that have the highest volumes, and that's where the highest numbers of deaths are likely to happen in the first place. And that's why at IRAP we encourage countries to set targets based on travel. So we're encouraging countries, for example, to say, why don't you try and ensure that 3/4 of your travel happens on roads rated 3 stars or better. You don't necessarily need to fix all your roads to make them 3 stars or better, but the priority needs to be where the highest volumes are and the highest exposure to risk is. So yeah, really interesting story that you can draw out from this data for New Zealand, for example. Now if we go back to the full data set, looking at all the countries, another story that we could explore is what are the star ratings at schools, for example. So if we use the filter and say, is there a school present? Click yes. If we take a look at the pedestrian star ratings, and pedestrians are the road user we're most interested in often at schools because they're the children walking along the road and trying to cross the road to get to class. You can see that about 1,000 kilometers of data is where there is a school recorded as being present. And same sort of story that we had as before, more than half of the roads at these schools is rated 1 or 2 stars. So 1 or 2 star roads at more than half of the locations where there's a school present. If we do another filter and look at the roads that are in rural areas, so schools in rural areas, the story changes dramatically. We can now see that more than 3/4 of those schools in rural areas have 1 or 2 star rating. So that means if we're thinking about safety at schools, about half the schools we looked at have 1 or 2 star rating, so quite high. And in the rural areas, nearly all of them, like getting up to 80% of the schools have 1 or 2 star rating. So those kids in rural areas getting to school whenever they're walking, they're facing a high level of risk. We can explore a little further about why that risk might be so high. If we click on the pedestrian tab at the top of the big data tool and use the filter again to pick up schools in rural areas, and we zoom up, this starts to explain why that risk level might be so high. In 87% of cases, where there's traffic travelling at 40 kilometres an hour or more, there's no sidewalk in place. So any kids walking along the road need to walk on the pavement and share space with often fast-moving traffic. In 3/4 of the cases, there's no pedestrian crossing present at the school. And where there is a pedestrian crossing present, about 50% are in poor quality. So we know that many of these schools, they're lacking facilities, the basic facilities that you would expect at a school where there's children using the roads. There's either no sidewalks or no crossing, or when there is a crossing, it's in poor condition. What that says is, if you're a government or a road agency or a school interested in safety of children at those locations, focusing in on making sure the pedestrian crossings that are there are good quality, and focusing in on the locations where children commonly cross the road and making sure there's facilities like a zebra crossing or a raised zebra crossing at that location is critically important. And similar for sidewalks. These sorts of treatments, they're like a vaccine for road crashes. Building a sidewalk really can cut down the risk for pedestrians walking along the road. Some of the other interesting stories, if we turn the filters off again, Rob, and just look at the entire data set, like we did looking for pedestrians and zooming in and finding out what is the cause of the high risk at these locations, we can do a similar thing for vehicle occupants. We can start to see why star ratings for the entire road network that we included might be high for vehicle occupants. One of the reasons is that many of the roads are undivided. 81% of the roads that we looked at don't have any sort of separation between vehicles travelling in opposite directions. They're just separated by a splash of paint, a white line. We know that when vehicles are travelling at 70 or 80 kilometres an hour, if they have a head-on crash at that speed, even in the safest vehicle today, your chance of being seriously injured or killed at that speed is really, really high. So roads like that, they have the risk of death and serious injury built into them. Similar situation with the roadsides. We know that if you hit a fixed object, even like a relatively small tree, if you hit an object at any sort of high speed, your chance of risk or death or serious injury is also really high. And many of the roads have dangerous roadsides, particularly at the curves where it's easier for vehicles to run off the side of the road. Intersections are also really interesting. Many of the intersections are lacking what we might consider to be basic facilities like protected turn lanes and really clear delineation. And many of the bigger intersections really can benefit by street lighting at night time to make them more visible and make it easier to navigate through. So many of the factors that are explaining the star ratings are available to see here in this tool. And there's got to be 1,000 stories like this that we can draw out from data like this. So we really encourage you to jump in there and explore and see what sort of stories you can draw out from this data. The other element of the tool that I wanted to share with you is what we call the business case for safer roads. What we've done here is a hypothetical to say, what if each country set a star rating target? And they implemented that with investment to improve the safety of their roads. What would be the impact in terms of lives saved and the economic impact of doing that? If we take Brazil, for example, so you can click on any one of the countries around the world, we can see that the World Health Organization estimates that each year there's 46,935 people killed on Brazilian roads every single year, a ginormous number. That's estimated to cost about 5.7% of the nation's gross domestic product. So it has this huge impact on the economy. And the economic impact of crashes and the financial impact is very often felt most by the poorest families. So losing someone in a road crash, a parent or a brother or sister, it has this enormous social impact and enormous emotional impact, but it has a financial impact as well, because the income for the family is often reduced, or the family has to borrow money to pay for the medical bills that they've incurred. So the economic impact of road crashes is really large. We know that, for example, if Brazil adopted a target to say, we will ensure that more than 75% of travel, so travel by vehicles or pedestrians, is on roads 3-star or better by 2030, they would have to invest $51 billion to do that. But they would save every single year more than 17,000 lives. 17,000 lives would be saved every single year by that investment. For every dollar they invested, there would be a return of $12. So for each dollar they invested in something like a sidewalk or a pedestrian crossing or a safety barrier, they would save the economy $12 through avoided crash costs and avoided insurance costs and loans that people have to take to pay for the medical bills. So this tool here, the business case, really helps everyone in your country to make the case for why it's worthwhile investing in road safety and improving the safety of roads. So really encourage you to jump into vaccinesforroads.org and explore the data and see how it can help you make the case for improving safety in your country.
Brilliant. Thanks very much, Greg. And as we know, there's a saying that we're drowning in data and starved of wisdom. Vaccinesforroads.org and our big data tool is there to give you the power to explore and understand how infrastructure impacts safety and how we can make a big difference with just simple, proven interventions that are so highly cost effective that there's no reason not for us to invest on a scale that matters. Because, as Greg highlighted for Brazil, that story is replicated in every country around the world. Low-income countries are impacted by road trauma, middle-income countries are impacted by road trauma, and high-income countries are impacted by road trauma at a scale that is unacceptable. But we know that if we can hit that UN target to have more than 75% of travel on 3-star or better roads by 2030, the reward is huge. 467,039 lives would be saved each and every year. Every life matters. Every life matters. And when we look at infrastructure investment, those examples that Greg gave, when you build it, it will be there for the next 20 years, saving lives, that footpath, that barrier, that divided road, that intersection upgrade. All there, saving lives and serious injuries every year. And looking at that over a 20-year period, we see more than 100 million deaths and serious injuries could be saved in total. That is an incredible lifting of burden from economies, from families, and most importantly, the individuals impacted. The economic returns are huge. $11,000 billion of economic benefits that we can unlock, taking those costs out of the health system, taking those costs out of insurance systems, out of welfare systems, and taking those costs out of the families who have to care for those injured in road crashes. And there's not many better returns on investment than investing in infrastructure road safety. $8 of benefits for every dollar invested. And that's true whether you're in a low-income country, we can see 18 to 1 return on investment, 9 and 16 to 1 in the middle-income countries, 5 to 1 investment in the high-income countries to get their trauma levels down by half at least as well. And overall, that huge return. $8 for every $1 you spend. What a public health spend that will be with high returns. So we can make that happen. And IRAP is a charity, and we build these partnerships with the countries themselves to work with Treasury and the road agencies to really understand that this is possible. And we have some fantastic case studies available for you to be inspired by. One of our favourites is Zambia. Zambia is a project where Amend, another charity, went into Lusaka and worked with one of the schools there that had had 4 injuries a year of school children just trying to get to school. And what they did is simple treatments like Greg mentioned, footpaths, a raised platform pedestrian crossing to slow the traffic at the point where pedestrians were crossing. Those school kids just trying to get to school. That investment took that location from 1-star to 5-star. I want my kids to go to school on a 5-star journey as well. But we've seen that success replicated on scale. Well, none better example than China. China has set this ambitious Highway Safety to Cherish Life program as part of their investment of over $5 billion to upgrade infrastructure safety right across China. They have done star ratings and investment plans on over 150,000 kilometres of road, and just in the last 2 to 3 years have upgraded over 105,000 kilometres of road. A fantastic success story is China Wrap, run by the Ministry of Transport in China. New Zealand, as Greg highlighted, has a policy target to bring their roads of national significance to 4-star standard, and that's return in terms of those results that Greg highlighted yesterday. Bogota, the Mayor of Bogota is doing a fantastic job focusing on the cycling and the pedestrian safety, raising infrastructure standards to 3-star or better for those vulnerable road users in our cities. And as we urbanise, that becomes even more important. And we're seeing examples from Australia where they are ribbon cutting these roads being upgraded to 4- and 5-star road. So ministers, designers, engineers, the road authorities, the mobility clubs can all stand side by side and celebrate success. The United Kingdom, another one that has a target for to get 90% of travel onto 3-star or better roads. And that's helping make a very big difference in there. And one of our last examples that I'd like to point to is Slovakia. They received an award from Commissioner Bush for their fantastic investment that took their motorway from 27% 3-star or better to 77%. Fantastic results, and we're seeing these examples everywhere around the world. And as I mentioned, every life saved matters, and this can be replicated on a global scale, and we can save so many lives if we'd make that happen. So we've just lost the slides there. Here we go, back again. So one of the exciting projects that's just about to happen here in Europe, where we are at the ITF forum, is Radar, a fantastic partnership as part of Interreg, the European Union funded program in the Danube region. And as we see the power of this information to provide confidence to governments to invest in 3-star or better roads, will be created across all of those countries that are part of that Danube program. That project is just about to start. The assessments will be done over the next 6 to 12 months, and the life-saving treatments will follow quickly behind that. And with the support from organisations like the European Bank of Reconstruction and Development, EBRD, those roads will get financed, those lives will be saved, and those economics returns will be available for those countries. And in every one of those countries, we really encourage them to own their own program. And now I'd like to introduce Judy Williams, our Global Program Manager, who can tell you more about how you can get involved. Judy.
We work with over 90 countries around the world globally in partnership with them. So it's all about local programs that are owned by these local communities and local countries. We have the tools and the recipe for success for them. So we're working very closely with the development banks, with the mobility clubs, with the governments and the local NGOs to develop the tools that they need. So whether it be to develop a program that is owned by the country or the state, we have the tools to assist them to make that happen. Also to run a project, be it an assessment on a road or risk mapping, where we're looking at the actual crash data, to developing safer road designs so that the least possible risk is built into the road design from the get-go, right through to informing how they spend their money to get the greatest possible gains in lives saved and serious injuries minimised, and right through also to informing policy so that the most number of lives and injuries can be saved through policy at a very broad national level. So if you've got any questions about that, how IRAP can help you, or the step plans we have for success, by all means come and see us today at the IRAP booth, or also by seeing the vaccinesforroads.org website.
Fantastic. Thanks very much, Judy. And as you can see, we have the recipe for success. We have the vaccines for roads that could save more than 467,000 lives each and every year by 2030. There is nothing stopping us make that happen. And we encourage all of you to visit vaccinesforroads.org and see how you can help save lives around the world as part of your RAP program. Thank you very much.